This week, Australia's healthcare system experienced what might be its most significant private sector shock in a recent memory. HealthScope, the nation's second largest private hospital operator, collapsed into a receivership on Monday morning, sending ripples through a healthcare ecosystem already under intense pressure. But this isn't just another corporate failure story. The collapse of Australia's second largest private hospital group is a canary in the mine for the private hospital sector. A health policy expert says with 37 hospitals across every state and territory, treating 650,000 Australians annually and employing 19,000 staff, HealthScope downfall represent more than that financial mismanagement. It's a symptom of systematic problems that could reshape how Australians access healthcare. The immediate facts are stark. Creditors are seeking a sale of HealthScope's business aimed at recouping what local media said was about 1.6 billion in debt. But behind these numbers lies a complex web of economic pressures, policy failures, and changing consumers' behavior that threaten the viability of private healthcare in Australia. To understand how we got here, we need to rewind to 2016. That's when Brookfield Asset Management, a Canadian American private equity giant managing over $1.4 trillion globally, made what seems like a smart bet on Australian healthcare. They bought HealthScope at a time when private health insurance membership was actively declining for the first time, a warning sign that should have been heeded. Brookfield bought HealthScope in 2019 with a goal to make as much money as possible for its foreign investors. But it took too much risk and too much debt. The timing couldn't have been worse within months. COVID 19 hit, bringing elective surgery to a standstill and fundamentally altering healthcare dynamics. But this wasn't just a bad luck. As Private Healthcare Australia CEO Rachel David pointed out, Brookfield was only ever in Australian hospital market for the short term. It is trying to squeeze out as much profit as possible before it abandons HealthScope hospitals, potentially making private healthcare unaffordable in the process. The private equity playbook often involves loading companies with debt, extracting value quickly, and then exiting. In HealthScope's case, that strategy collided with the reality of running essential healthcare infrastructure during a global pandemic and a cost of living crisis. Multiple crises converged to create HealthScope downfall. Health economist Anthony Scott from Monash University outlined the key factors: workforce shortage, inflation pressures, declining private health insurance membership, and brutal negotiation with the health insurers. From 2018 to 2023, total private admissions have grown at a compound rate at less than 1%. This stagnation occurred despite an aging population and rising chronic disease prevalence, factors that should have driven growth. The workforce crisis proven particularly damaging. COVID-19 saw many experienced staff, especially in theater, nurse, and unit managers, leave permanently. The aftermath of COVID-19 saw many experienced staff, particularly theater nurses and unit managers, depart, which disrupted teams and affected productivity. Hospitals were forced to rely heavily on extensive agency staff, driving up costs just as revenue grew stagnant. Meanwhile, Australians were making difficult choices about their healthcare spending. APRA's data is backed by finding from Private Healthcare Australia, the peak body representing 98% of Australia's private insurance sector, which found more than 216,000 policies were downgraded in the first half of 2024. Perhaps the most dramatic precursor to HealthScope collapse was its public war with health insurers. In late 2024, HealthScope took the unprecedented step of threatening to terminate contracts with major insurers, affecting 6.6 million Australians with private health coverage. The company wanted to charge patients directly $50 for the same day services and $100 for overnight services on top of insurance payment. This move was described as bringing American style healthcare going to Australia. Health insurers push back hard. The truth is, HealthScope Hospital are struggling because its private equity owner Brookfield took a punt in 2019 that went wrong. This has nothing to do with health insurer payments to hospital on behalf of their members, argue Private Healthcare Australia's CEO Rachel David. This public battle expose the fundamental tension in Australia's hybrid healthcare system. The private hospital want higher payments to cover rising costs, while insurers resist increases that will drive up premium and cause more Australian to drop coverage entirely. Federal Health Minister Mark Butler's response to the crisis revealed both that the government constrained and its priorities. Butler said there will be no taxpayer-funded bailout of HealthScope owners. Federal Health Minister Mark Butler's response to the crisis revealed both that the government constrained and its priorities. Butler said there will be no taxpayer-funded bailout of HealthScope owner, Canadian asset management giant Brookfield. This position, while fiscally responsible, underscores a critical policy challenge. Butler acknowledged the broader crisis, stating there has been some viability challenges to private hospitals, while emphasizing that 1 in every 7 or 8 private hospital procedures in Australia was in a HealthScope hospital, meaning its collapse would put further strain on public resources. The government's dilemma is clear. It's provide about $8 billion annually in taxpayer support to private health insurance through rebates, yet has limited control over how private hospitals operate. When these hospitals fail, the public system absorbs the displaced demand, creating a costly double burden for taxpayer. The immediate impact appears manageable. CEO Tino Laspina of the HealthScope told a press conference there was a buyer interested in taking over the business as a whole, while assuring its hospital operation will continue as usual. Commonwealth Bank has provided a $100 million lifeline to keep operation running during the sales process, and all 37 hospitals remain open with no planned closure or redundancies. But industry insiders paint a more concerning picture. An investor who has viewed the investor memorandum detailing the health of the business said only 3 to 5 of the hospitals were profitable. This suggests that any new owner will likely need to rationalize the portfolio of potentially closing smaller, unprofitable facilities. The broader implications are troubling. As the health economist Anthony Scott noted, this collapse signals that the private equity firms do not see private hospitals as financially viable. If investment capital flee to the sector, Australia could see more closure, reduced capacity, and greater pressure on public hospitals. The HealthScope collapse forces uncomfortable question about Australia's healthcare model. Can a hybrid public-private system function effectively when private operators prioritize short-term profits over long-term healthcare provision? How can governments ensure essential health infrastructure remain viable without creating moral hazard through bailouts? The warning sign has been accumulating for years. declining private health insurance membership, rising out-of-pocket costs, workforce shortage, and the closure of specialized services like maternity wards. HealthScope collapse simply crystallized these challenges into one dramatic moment. Looking forward, the sector may need fundamental reform. This could include better regulation of private equity ownership of healthcare assets, improved coordination between private and public systems, perhaps a rethinking of how healthcare infrastructure is financed and operated. For now, Australian patients and healthcare workers wait to see who will be buying HealthScope asset and what vision they'll bring to private healthcare. But one thing is certain, the canary in the coal mine has stopped singing, and the healthcare system must heed its warning before birds fall silent. The next few months will determine whether this crisis become a catalyst for necessary reform or merely the first domino in a larger collapse of Australian private healthcare infrastructure. That's for today. Inside OSPO, I'm Mika Santos. Thank you.